Welcome to our Introduction to Patient-Centered Research. After this presentation, you will better understand what research is, the importance of doing research on health outcomes, and why it is important that you are here today. If you have any questions at the end, please ask your facilitator. If we ask people, what is research, what would they say? When we asked people, what is research, they said monkeys, mice, rats, guinea pigs. When we asked people, what is research, they said the Tuskegee syphilis study. When we asked people, what is research, they said testing drugs on people. When we asked people, what is research, they said data, lots of information, numbers. Research is important because it can bridge the gap between questions and answers. What do the experts say? They say research is a systematic investigation intended to lead to generalizable knowledge. In other words, does this seizure medicine work on kids? If people get screened for colon cancer, do they live longer? What qualities make the best doctor? What is the best test for HIV? What is the best way to prevent diabetes? If we ask people who pays for research, what would they say? They could say pharmaceutical companies, the government, rich donors, or charities. And they would be right. In 2011, industry paid $80 billion for research. The government paid $40 billion for research, and other sources like St. Jude's Children's Hospital, the American Heart Association, Susan G. Komen for the Cure, and colleges and universities paid $20 billion for research. But where does the money from the government come from? U.S. government organizations spend billions of dollars on health research every year. These are organizations like National Institutes of Health, Centers for Disease Control, Department of Defense, Veterans Administration, and many others. Your tax dollars pay for government research, but who decides which questions get asked? Pcori wants it to be you. What is Pcori? It stands for Patient-Centered Outcomes Research Institute. It is an independent, nonprofit health research organization funded by the Affordable Care Act. It wants to find answers to health outcome questions that are important to people like you. Health outcomes are things that affect you when you go to the doctor. Objective things like how many people live and die, how many people get disease, and what exams find, as well as subjective things like how much pain and tiredness you feel or how anxious you are. There are many areas to research in health outcomes. They include promoting health, the causes of disease, inequalities in health, comparing approaches, improving doctor-patient relationships, understanding what quality of life is for different sorts of people, improving access to care, and how to treat people with multiple health conditions. What types of health outcome research are important to you? Sometimes a doctor may think a health outcome is good, but the patient may not agree. In this cartoon, the doctor is happy because the tests are negative, but the patient isn't happy because they are still having problems in their day-to-day life. Some health outcomes are important for some people, like can doctors treat patients well when they don't speak their language? And some health outcomes are important to others, like what is the best way to stop older people from falling? What happens when different people want to do research on different health outcome questions, like the scientists wanting to ask certain questions and the patients wanting to ask different questions? People from different perspectives want to ask different research questions. The questions scientists want to ask are not always the ones patients want to ask. For example, is this a good seizure medicine for kids? Does the medicine stop or slow the seizures? Does the medicine make my kids too sleepy to do well in school? When should people get screened for colon cancer? At what age does the screening find the most people with colon cancer? At what age should people like me first get screened? In summary, historically, research funders have asked scientists what questions are important. Now, they want to know what is important to you. Without your input, we can only guess what issues are important to you. With your input, research has a better chance of answering health questions important to you. Scientists and patients must work together to ask questions that are important to all of us. Thank you for helping us make it happen.